At the present moment, our backup generator is not working. We're in the process of trying to get it fixed. But unfortunately, also taking into consideration the high fuel prices, it is going to be very, very expensive for us to be running that generator for the long periods that we're experiencing the power cuts, sometimes exceeding 18 hours per day. Probably a lasting solution to that would be installation of a solar plant that is big enough to power some of the equipment that we have in the various departments that we have at this hospital. And just to be specific with regards to the departments that are negatively affected, we start off with the autoclave machine that we use for sterilizing the equipment that we use in theater. Apparently, since we don't have power during the day, we have resorted to allowing those people who are working in the sterilizing department to come and sterilize the packs during the night, during the 3 to 4 hours, or sometimes 4 to 6 hours that we have power. That's when they come. That's between 11 and 3 a.m. Then the X-ray machine, initially it was broken down due to the power surges. We have managed to get it fixed, but unfortunately, those patients that are coming to have X-rays taken during the day, we cannot assist them without power. So it means we are actually encouraging people, if possible, they could come at night. But as you know, it's not very convenient for people to be coming for such services, which are not necessarily emergency services during the middle of the night. Then our kitchen department, cooking for patients is also a challenge. What we have resorted to doing at the present moment is using alternative sources of power. So we are using either gas in order to cook or firewood. Then the laundry department is also the other department that has been affected. And apparently those who are attending to the laundry in that department are coming at night, so that they do their laundry at night, and also during the day at least we have sunlight and they will be able to dry the linen. Then in the wards, lighting has been negatively affected as well. So it also impacts on the quality of patient care that the healthcare workers actually give, because with poor lighting you might end up making mistakes. As an institution, we are trying to procure solar lamps, but at times the quality of light that we're getting is not necessarily the ideal. Then we have departments that are heavily reliant on electricity. Departments like the health information, the accounts department. So the efficiency of those departments has been compromised, because the cadres, they have to wait for electricity to come back in order for them to generate their reports that are needed, and at times it's just too stressful to these cadres. Of course, they're trying, they're giving it their best, yes. Then the other problem that we've been having is we've been having a breakdown of office equipment, specifically computers in our offices, because we sometimes have power surges, and these equipment, they end up getting broken down. Then finally, there is the issue of the mortuary, which is actually failing to maintain the required temperatures that are necessary to slow down the decomposition of dead bodies. As a result, we are getting some of the bodies actually going into very serious decomposition states. So in order to try to remedy this, we are in consultation with departments like the police and the social welfare, and actually trying to expedite the burial of the pauper bodies that have been occupying our mortuaries. Then we are also urging the community members to try and expedite the burial of their deceased loved ones, so that at least they will not go bad in our mortuary. But a major recommendation that we have also put forward to the power company is that we are actually appealing for a dedicated power line to the district hospital, which is exempted from power cuts. I'm sure if this is done, we can actually find a lasting solution to our challenges. Thank you.